Chemotherapy-induced neutropenia is the most common toxicity caused by the anti-cancer drug treatment. In a large prospective registry, 37% of the breast cancer patients experienced an absolute neutrophil count, which is ANC lower than 500 cells per millimeter over the first cycle of treatment. And approximately 70% of the initial episode occurred after the first cycle. The potential risk of chemotherapy-induced neutropenia can be patient or disease or treatment-related factors. Of course, age is the most important patient-related risk factor. Increasing age is associated with the greatest risk of neutropenia. And disease-related factors include the bone marrow involvement and type of cancer and previous history of myelotoxicity. Treatment-related risk factors include the radiation therapy to the bone marrow, type of prior chemotherapy, and the treatment regimen with the mono or combinational chemotherapy. The NCCN guidelines state that for patients with febrile neutropenia risk equal or greater than 20%, primary prophylactic G-CSF use is appropriate for first and all cycles of treatment. If patient with a febrile neutropenia risk between 10 to 20%, if they have at least one of the following risk factors, such as prior chemotherapy, radiation therapy, and persistent neutropenia, bone marrow involvement by the tumor, or recent surgery, or any open or fungating wound, or liver renal dysfunction, or elderly patient, if they have the risk factor, prophylactic G-CSF use should be considered. And for patients with febrile neutropenia risk of less than 10%, usually prophylactic G-CSF use is not recommended.